paramedics fear patients will be forced to wait longer for ambulances to arrive.
Yes, NHS is set to introduce electric ambulances, raising concerns that the drive for net zero may be putting patient safety at risk. A test group found the electric ambulances took up to 4 hours to charge and travelled only an average of 70 miles.
Well, joining us now is consultant oncologist and former director of the World Health Organization Cancer Programme, Professor Karol Sikora. Now, Professor, this seems to be a big drive, but, if you'll pardon the pun, but frankly, there are some concerns that the technology isn't quite where we'd want it to be in terms of charging hubs and range, really, of these new ambulances, particularly perhaps for rural areas?
I think it's perfectly predictable. That's the problem. You can work out the downtime of an electric vehicle compared to a petrol vehicle. So I don't see how this could happen. It means you have to have more vehicles, you have to have more staff and all the rest of it. If you're not prepared to do that, and I would suggest this is not the time to be doing it because of huge problems the NHS has, is not the net zero for the NHS is not about just transport by car. It's about how hospitals run, how the very dated estate of the NHS is used optimally. And it takes time, people's time away from what's really important, clearing the backlogs. 7.8 million, whatever the figure, it's probably 10 million in reality, are waiting for something. Let's get that sorted and then do the luxuries like this.
Well, you raise a very good point. I'm struck. Firstly, I didn't know that that NHS England had a greener NHS team. Apparently, the combined salary bill of this green team is £3 million a year. 48 roles have been made, and essentially, lots of decisions have to tick a green box if they're to be made. It seems there's so much bureaucracy going on. It says no decision can be taken without a product's social values and contribution to emissions targets being considered. Why on earth is the NHS worrying about its carbon footprint when, as we say, we've got record waiting lists?
I know. You give up in the end. Every time you do anything, you have to make a business case for something. You have to say how green it is to show that you're actually observing. Now, it can be tokenism, but if you're going to do it properly, you're going to have to hire people to advise you. You're going to have to hire people to judge the business proposals to see how green. Now, this is great if we're really performing well, as many European health services are. They're performing very well. We're not. No one can say the NHS is performing well at the current time. The people are great. There's nothing wrong with the clinical front line. They're fabulous. They're polite. They're empathic. They're competent and skilled. But the problem is the whole organisation is sick. And just putting another 50% of money into it would do no good whatsoever.
Especially, I suppose, if that extra money is going to perhaps, and there have been tens of thousands more nurses, but if they're spending an ever larger proportion of their time filling out forms and ticking boxes and making the green case, the business case for various forms of medicine and treatment, then it doesn't matter how many more nurses you have, because so much less of their time is with the patients.
Getting the front line, just doing frontline tasks is so important, and that's been forgotten about. If you're managing a supermarket, you would want to make sure that patients can access what they want in an orderly way and get to the till and get out quickly. That's what supermarket managers do. We don't have that effect in the NHS. It's just so slow.
Professor Sikora, is what you're saying here that actually getting rid of all of these middle managers was a bad thing? We need a certain level of middle management to do the form filling so that the clinical staff can work on the wards.
I know. And the trouble with middle management, you have middle managers filling the forms and middle management assessing the forms. So you've just got a double system, and it just burgeons, just grows and grows every year. And it's the same with the diversity. It's exactly the same. You have all the graduates paid $100,000 a year to come and develop a job and trouble people like me, with forms to fill and looking at everything you do in a different light. Sure, we've got to respect green and we've got to respect diversity. There's no problem with that. But we don't need an army of bureaucrats. No other business organization would do that. They just do it naturally. The managers are empowered to take action and do it.
Well, thank you very much indeed for talking to us, Professor Karol Sikora. Great to get your view on all of this. I mean, Tom, from next month, every NHS supplier, so any company or whatever that sells a product, a medicine, a machine, will have to draw up a carbon reduction plan. I mean, seriously.
So this isn't just the NHS dragging itself down and building its costs up because of its own regulation. This is now the NHS exporting its regulation to the private sector. If you want to do business with the NHS, you have to lumber your business with as much bureaucracy as they have.
So if I want to sell a particular medicine to the NHS, or an asthma inhaler, or a particular type of pen to the NHS, because it could be down to the pens they use, I have to fill in a carbon reduction plan.
And do you know what that means? It won't be the cheapest pens or the best value for money pens being sold and therefore saving the NHS money and therefore saving the taxpayer money. It'll be the asthma inhalers or whatever that come from the company that has the big compliance department that probably adds an extra 50% onto the price of its products.
Probably.
Then the taxpayer has to lump out for. This is cost upon cost upon cost.
Well, there's a question for you at home. Should the NHS be spending £3 million on a green team? I mean, I didn't even know the NHS had a net zero team, but there you go. Of course it does.